Screen. All right then. So I'd like to say hello and welcome to another presentation by We Two Geniuses. And I'd like to introduce to you the word infectious disease that we both made. So let us first introduce ourselves with the term infectious disease. Infectious disease or transmissible diseases are caused by a microorganism called pathogens, which can be in the form of a virus, of a bacteria, of an archaea, etc. Transmissible diseases can sometimes cause interspecies diseases, such as flu, which can be transmitted from an ape to a human being and vice versa. First, after we understand what is transmissible disease, we would like to learn a bit about cholera. What is cholera? Cholera is basically a disease that causes some tummy issues. And this tummy issue is not just a small, tiny tummy issues. It's a tummy issue that could actually cause death if left untreated, and therefore must be treated as quickly as you can. And the diagram shows on the right shows the features of cholera. See for a moment. Well done. Moving on. So first, we have to start a bit about cholera itself. So cholera is an acute diarrheal disease that can kill within an hour if left untreated. It was first discovered in the 19th century from its original reservoir in the Ganges Delta in India. Subsequent pandemic killed millions of people across all continents. The current pandemic starts in South Asia, reached Africa in 1971 and the Americas in 1991. So how do we get infected by cholera? Cholera can be transmitted easily through water and food. If the food is dirty or the water is untreated, you can get yourself cholera and therefore causes a major issue. Then the question is, how do we prevent cholera from destroying your body? First, we must use proper latrines or toilet. If you have a toilet in your house, use it. Don't poop outside or poop in the river, and you will cause some issues. And therefore, peeing or pooping in open body of water can spread cholera. And as you might be a carrier of it, no one knows if you can carry cholera or not. But there's a huge chance that you can carry cholera. Drink or consume food in a clean restaurant and place or sealed properly in its containers. There is a chance that the chef or a food handler might not wash their hands. To be safe, make sure that food is in as clean hands as possible. Cook food and boil water properly. Most bacteria die at 65 degrees Celsius, and therefore cholera can be killed by heating up your food properly. If we don't clean your waters using heat or, of course, cook your food properly, you might actually get yourself cholera. Well done. We just cause infections. And clean food preparation areas and kitchenware with soap and safe water, and let them dry completely before reusing them. So therefore, this is why your mothers and your fathers, if your father cooks, might nag at you for not cleaning your knives or your pans or your plates, let's say. Because if you don't clean your plates, the biggest issue that you will have is that you might actually cause cholera. There might be some cholera bacteria, Vibrio cholerae, inside the plates. Of course, wash your hand a lot. If you don't wash your hands a lot, cholera might come in, and today, COVID. If in case you got yourself cholera, if you are infected with cholera, well then, there is a few ways that hospital might treat cholera, and this is how they do it. For treatment of cholera, we have to understand that cholera attacks the body in a way that destroys the cell lining of the intestines. So therefore, the question is, how do we make sure that materials can be absorbed by the damaged cell linings? Simple. This can be controlled through the usage of a very concentrated glucose solution. This or saline solution that is very concentrated. And this is in order to make sure that to maintain the osmotic balance of the blood and tissue fluids. And you can see that is how we treat cholera. Look at to the left side of the picture. Look at this left picture right here. You see that this is basically during an outbreak of cholera. You see that there are tubes, right? There are tubes. These are the saline and glucose solutions that I've been talking about. Malaria. Now, of course, malaria, the hot debate of our country. Malaria is caused by a protista called as a plasmodium. It's a plasmodium, and it is transmitted through an Anopheles mosquito. And in most cases of malaria are caused by one of four species of the Protoctis plasmodium, whose life cycle is shown in the next slide. This is how plasmodium destroys your body and infecting you with this disease. The parasite has two hosts. The sexual stage occurs in mosquitoes, the actual stage in humans. The time between infection and appearance of parasites inside red blood cells is 7 till 30 days in Plasmodium falciparum, longer in other species. And it's longer in other species. Look at the diagram. We see that infected mosquito takes the blood meal from the infected person. Infective stages of parasite enters the bloodstream and then liver cells. And then the parasite leaves the liver cell, but it has been reproducing. And then what happens here is that you got malaria. Destruction of your body occurs and another mosquito takes your blood and continues the cycle forwards. And you can see in this diagram how the Plasmodium parasite infects the whole cell by infecting the red blood cell first and then multiplying by using red blood cells itself. You get that. If you see that this blue thingy, the blue thing inside the red blood cells is the Plasmodium falciparum. And this is how we treat malaria. This can be treated by using anti-malarial drugs such as quinine and chloroquine, which is called as a prophylactic drug, which stops an infection occurring if a person is bitten by an infected mosquito. This sort of drug works by inhibiting the photosynthesis of Plasmodium, making it incapable of reproducing and bursting its cell membrane open, killing it during its reproduction cycle. However, prophylactic drug does not grant the body immunity. It's not a drug that is like a normal vaccine. It's basically a chemical drug that is used to destroy Plasmodium directly. Instead of instructing the cells, the red blood cells and the memory cells, the killer T cells and stuff, on how to destroy malaria. But it just destroys the malaria directly, but the body gets no immunity from it and thus must be taken in regularly. And this is the question, where does malaria occur? Malaria occurs in places where the mosquito, the Anopheles mosquito, exists. It means that in warmer climates such as Africa, Central and South America, Dominican Republic, Haiti, and other areas in the Caribbean, blah, blah, blah. Right here, you see the list. It's mostly in warmer climates such as, of course, this country, and of course, everything in the equator. How common is malaria? It is really common in tropical areas where it is hot and humid, where mosquitoes live and thrive. 2,000 people get malaria every year worldwide. More than 220 million people get malaria annually. The majority of these cases occur in Africa and South Asia. Around 450,000 people die from the disease every year. You might get malaria. Most of them, more than 90% of malaria deaths occurs in Africa, and nearly all of the people who die are young children. In the United States, it's pretty rare. The reason is simple, because you need the mosquito to exist. So it doesn't exist in the Americas because it's cold and not humid, but in Africa, it is hot, humid, and there are a lot of waters where the mosquitoes can breed in. And therefore, It exists in Africa, but not in the United States. And no one can get malaria. But it is because in Africa, you see that the infrastructures and the indication is so low that people don't really understand that there is a mosquito there. It is dangerous. So yeah, they don't think that it's a huge problem. So yeah, well done. You got malaria because of that. So what are the symptoms of malaria? Malaria can have a few symptoms such as the following: fever, sweating, chills that shake the whole body, headaches and muscle aches, fatigue, chest pain, diarrhea. As malaria progresses, it can cause anemia and jaundice, along with green and white of the eyes. How to prevent malaria? Malaria is transmitted by Anopheles mosquito. This can be prevented by making sure that your environment is clean, by making sure that there is no place for the mosquito to breed. Therefore, you must clean your water and remove every water surfaces that you can find, closing it, or even, of course, throwing it out if you don't really need it. Other than that, keep a can or 20 mosquito sprays or an electric mosquito racket. Destroy these mosquitoes, killing them immediately using an anti-mosquito repellent. This we also have HIV and AIDS. HIV and AIDS, you see, this is what happens. What is HIV? It's human immunodeficiency virus. It is transmitted through sexual intercourse. And of course, through hypodermic syringes modified to fetus across the placenta at birth. And of course, will be distributed everywhere. Incubation period. There you go. Site of action of patagonia, the helper lymphocyte, clinical features. Yes, and of course, the following. So therefore, we're going to see first thing, the symptoms of HIV, primary infection, acute HIV. Some people infected with HIV develop a flu-like illness within 2 to 4 weeks after the virus enters the body. This illness, known as primary acute HIV infection, may last for a few weeks. The possible signs and symptoms include fever, headache, muscle aches, joint pain, rash, sore throat and painful mouth sores, swollen lymph glands, mainly on the neck, diarrhea, weight loss, cough, faint night sweats. Clinical latent, and of course, the reason why you have these symptoms is simple, because there are no helper T cells, there are no immune systems to prevent viruses and bacteria and pathogens from entering your body. So therefore, it is very vulnerable. It's very vulnerable to any infections, and your body simply could not stop those infections because there is no immune system to speak of when you get HIV. It soon develop into AIDS. And of course, we have clinical latent infection, the chronic HIV, that happens after a couple of years, after a few months of getting first HIV. You see here, HIV is still present in the body and in white blood cells. Many people may not have any symptoms of infection during this time. This stage can last for many years. If people not receiving antiretroviral therapy, some people may develop severe disease much sooner. As the virus continues to multiply and destroy your immune cells, the cells in your body that help fight off germs, people may develop mild infection chronic signs such as fever, fatigue, and so on, because there is no immune system. And it progresses to AIDS. And thanks to the better antivirus treatments, most people with HIV in the US, they don't develop AIDS. Untreated HIV developed into AIDS, which is terrifying. When AIDS occurs, your immune system disappears. There are no red blood cells. There are no white blood cells to speak of. There is nothing to produce white blood cells anymore because it has been infected by that virus that is called HIV. It destroys everything. Well done, you have no immune system, so well done. You can't live. And it says in your body that that you may say, it's fine, it's just a common cough because I drank too much soda yesterday. Could develop into a deadly disease because there is no immune system to stop any viruses. So you're dead. You're dead. You're going to die in a few months or days. Even if you get a common cold, you're going to die. Just die. And this is how HIV is transmitted. HIV is transmitted through a few ways, mostly in the bloodstream, but most importantly through sexual intercourse. In the 1980s, people in North America and Europe, HIV was very, very epidemic amongst male homosexuals who practiced anal intercourse and had many sex partners. The reason? The mucus lining of the rectum is not as thick as that of a vagina. There's less natural lubrication. Therefore, the rectal lining is easily damaged during intercourse and the virus can pass from semen to blood. We get HIV. We have few facts about HIV and AIDS. 70% of the world's deaths from AIDS occur in Africa. The reason why is because of the culture in Africa. First, the culture in Africa, and secondly, the lack of of what's called lack of education in Africa. And thirdly, the culture, education, and of course, just weird stuff. So the reason why you see the following data is simply put, in Africa, you have basically the culture of polygamy still is very common in Africa. I'm not kidding, polygamy is still common, especially in the middle part of Africa. In the middle part of Africa, you see that the middle part of Africa is the least developed. In the northern part, you see that most of people are more Berber and Arabic, but in southern Africa, you see more developedness. But in middle Africa, in the middle of Africa, you have people that are less developed, and therefore, well, they don't know. So yeah, well done. They got HIV. They got HIV because they commit polygamy a lot. Because that's the issue. You will see that documentaries will say that. And that's why you see that 25% of the population of Botswana is infected with HIV. And over 60 million children are estimated to have lost one or both parents with AIDS. This is 25% of population under 15. Large proportion of women in Rwanda are HIV positive following the use of rape as a genocidal tool. Happened in the civil war of the early 1990s. Unfortunately, this is just how it is, unfortunately. And you can see the distribution here of AIDS, of HIV and AIDS. You see that in the red parts right here is basically where sex is unregulated, where you see that there are large amount of prostitution. You see that, for example, like in most African countries, you see that rape and prostitution is such a common thing, while in whiter parts, it's basically, rape, prostitutions are almost outlawed, especially in the parts of Saudi Arabia and Algeria and stuff like that. And the reason why you see that they're white is simply put, they have laws preventing and outlawing prostitution, and raping can cause actual death, probably to some extent. And you see that that in Europe, you see that there is a lower number. So like that's good. And in America, you see that there is a slight rise, and that's not good. And Russia is even more because there aren't any regulations stating that you can't have prostitutes. And therefore, because of unregulated sex, you have HIV and AIDS that is in a larger amount, unfortunately. So how do we prevent it? Simply put, don't do free sex. Don't do free sex, and don't do free sex, that's it. Don't use needles and syringes that have been reused over and over again. Please don't. That is the primary cause of HIV, and which will develop into AIDS. Right? Don't have free sexual intercourse with anyone that you don't even know. If you want to have sex even, then please use protection. If you are a male, use condom. Condoms aren't that expensive. You can buy it from your nearest store. And for a female, use a femidom. And even then, still don't even you don't still have to do it. Just don't. Please, no, just no. Right? It prevents like 5% of HIV cases, but there's still 1% that you can get HIV, especially if your condom is ruptured or there's small hole, microscopic hole. Yeah, I still don't want to do that. So right now we're going to move on to Mr. Hayato. Hey, go.
How tuberculosis, TB or TB. The tables show in the right the feature of TB. So the pathogen is called Mycobacterium tuberculosis Mycobacterium bullfish. Method of transmissions: the airborne droplets via undercooked meat and unpasteurized milk, or dirty milk. Global distributions worldwide. The incubation periods, few weeks or up to several years. Site of actions of pathogens: primary infection in the lungs, secondary infection in limbs, lymph nodes, bones, and gut. Clinical features: racking cough, coughing blood, chest pains, shortness of breath, fever and sweating, weight loss. And methods of diagnosis is microscopical examinations of sputum for bacteria, chest X-ray. Annual incidence worldwide in 2012, 8.6 million. Annual mortality worldwide in 2012 is 1.3 million, including 32,000 deaths of people who were in the HIV plus. Next. Symptoms of tuberculosis. Typically, symptoms of TB include, before I already said it, the weight loss, night sweat, high temperature, tiredness and fatigue, loss of appetite, swelling in the neck. Yes, next. Transmission of TB. TB bacteria are spread through the air from one person to another. So, example, if I coughing to the others friends or people, the friends or people will get infected. So but the TB or tuberculosis is not spread by us shaking someone's hand, sharing food or drink, touching bed lines or toilet seats, or sharing toothbrushes. Next. Treating, how to treat the TB. So first, pulmonary TB. We will be prescribed at least a 6-month course of combinations of antibiotics if you're diagnosed with active pulmonary TB, where your lungs are affected and you have symptoms. The usual treatment is antibiotics, ionized and lifamycins for 6 months. And next is additional antibiotics, pyrazinamide and ethambutol for the first 2 months of the 6-month treatment period. It may be several weeks before you start to feel better. The exact length of time will depend on your overall health and severity of your TB. After taking antibiotics for 2 weeks, most people are no longer infections and feel more better than before. Next. And next is extrapulmonary TB. Extrapulmonary TB that occurs outside the lungs, can be treated using the same combination of antibiotics as those used in treating pulmonary TB, like before. So, and next, multi-drug resistant TB. So there is a TB that like resistance in the drugs. So this is uncommon in the UK. There are strains of TB that are resistant to more antibiotics. This is not a multi-drug resistant TB. Multi-drug resistant TB require a much longer course of antibiotics between 9 to 24 months, depending on the strain. Multi-drug resistant TB tends to have less favorable outcome than standard TB. Next. Next. Okay, this table or the diagram shows the global distribution of TB in 2010. So as you can see in the nations like in Africa and some part of the South America and like a Caribbeans, Asia and Russia, yeah, and the Middle Asia like India, Pakistan, and others has a higher rate for tuberculosis, this distribution of tuberculosis. Okay, next. How to prevent the TB or tuberculosis? The only vaccine available for TB is the BCG vaccine, which is derived from M. Bovis and protects up to 70 until 80% of people who receive it. The effectiveness of the vaccine decreases with age unless there is exposure to TB. Many countries with high numbers of people with TB use the BCG vaccine to protect children from getting the diseases. Countries such as the UK and USA do not include BCG vaccination in their immunizations programs. Instead, it may be given only to people who are at high risk of becoming infected because, for example, they live with an adult who is being treated for the diseases. Cattle are routinely tested for TB, and any found to be infected are destroyed. TB bacteria are killed when milk is pasteurized. Taste control methods are very effective and have reduced the incidence of human TB caused by M. Next. And next is measles. Measles is caused by a virus which enters the body and multiplies inside cells in the upper respiratory tract. There are no symptoms for 8 until 14 days after the initial infection, and the rash appears and a fever develops. Other symptoms are runny nose, a cough, red and water eyes, and small white spots that may develop inside the cheeks. Treatment involves bed rest and taking medicines to lower the fever. There are no specific medicine for measles now. Next. Treatment. There's no specific treatment, as before I already said, for measles, but the condition usually improves within 7 to 10 days. A GP will probably suggest taking things easy at home until you feeling better. Stay away from, and don't forget, stay away from work or school for at least 4 days from when the measles rash first appears to reduce the risk of spreading the infection. You should also try to avoid contact with people who are more vulnerable to the infection, such as young children and pregnant women. Next. This is the pictures show the measles morbillivirus. Yes, next. History of measles. In the 9th centuries of Persians, doctor published one of the first written accounts of measles diseases. Francis Home of Scottish physicians demonstrated in 1757 that measles is caused by an infectious agent in the blood of patients. Next, transmission of measles. Measles is highly contagious virus that live in the nose and throat mucus of infected persons. It can spread to others through coughing and sneezing. If other people breathe the contaminated air or touch the infected surface, then touch their eye, nose, or mouth, they can become infected like COVID-19. Next. Measles vaccines. Measles can be prevented with MMR vaccine. The vaccine protects against 3 diseases: measles, mumps, and rubella. And next, the Indian Academy of Pediatrics, or IAP, recommends measles vaccine at 9 months of age. They also recommend to offer MMR vaccine to all parents who can afford it as 2-dose schedule. 1 at 15 until 18 months, and seconds at school entry. Okay, next. Antibiotics. So now I want to move to antibiotics. An antibiotic is a drug that kills or stops the growth of bacteria without harming the cell of the infected organisms. Antibiotics are derived from living organisms, although they are often made more effective by various chemical processes. There are a wide range of antibiotics to treat bacteria infection other than antimicrobial drugs such as isoniazid used for the treatment of TB are synthetic. Next. And how antibiotics works? Antibiotics interferes with some aspect of growth of metabolism of the treated bacteriums. Antibiotics work by blocking vital process in a bacteria, killing the bacteria or stopping them from multiplying or reproduce. This helps the body's natural immune system to fight the bacteria infections, like the diagram shows in the below. Next, the history of vaccine. The Edward Jenner, he is from UK, is considered the founder of vaccinology in the West in 1796 after he inoculated a 13-year-old boy with vaccine virus, cowpox, and demonstrate immunity to smallpox in 1798. The first smallpox vaccine was developed. Next. Antibiotic resistance. So there is a diseases or maybe diseases or bacteria that can be resistant by antibiotics. So penicillin has no effect on M or tuberculosis because the thick cell wall of the bacterium is not very permeable, and because the bacterium has a gene that code for an enzyme that catalyzes the breakdown of penicillins. Proteins in the membranes of other species of bacteria can inactivate antibiotics, so they have no effect. Bacteria membrane also have proteins that pump out antibiotic. If they enter the cytoplasm, in some cases, the antibiotics simply cannot bind to the intent site of actions. Bacteria that are sensitive to antibiotics are described as being susceptible to the antibiotic. They may become resistant if they gain a gene coding for a protein that protects them from the antibiotic. Penicillin has a structure that can be broken down by beta-lactamase penicillinase enzyme. I'm so sorry. So next will beta-lactamase or penicillinase enzyme pathogenic bacteria that have become resistant to penicillin have often done so because they have acquired the genes that code for this enzyme. Next. The diagram shows vertical and horizontal transmission of resistance in bacteria. Next. Okay. Choosing effective antibiotic. This is important because the antibiotic should be chosen carefully, because testing antibiotic against the strain of the bacterium insulated from people ensure that the most effective antibiotic can be used in treatment. As fast as we develop new antibiotics, bacteria seems to develop resistance to them. It follows from this that there is a constant search for new antibiotics, especially ones that work in a completely different way from those currently in use. Next. Thank you.
Finished presentation. I'd like to say thank you to all who have listened to us. Thank you.
Thank you.